Good afternoon, everyone. Can I remind members that social distancing measures are in place in the Chamber and right across the campus? Would members please take care to observe these, including when entering and exiting the Chamber? And the next item of business is portfolio questions, and the first portfolio is education and skills. Would those members who wish to ask a supplementary question please press the request to speak button or indicate in the chat function if you're joining us remotely. Question number 1, Joanne Lamont.
Thank you. To ask the Scottish Government what analysis it has carried out of the number of school pupils in Glasgow experiencing digital exclusion.
John Swinney.
The Scottish Government worked with local authorities through COSLA, the Society of Local Authorities Chief Executives and the Association of Directors of Education to establish the scale of need across Scotland. Councils and schools know their learners and families best. Therefore, funding of £25 million was allocated via a formula based on deprivation and rurality for them to address local need. Glasgow City Council received £3.1 million, through which they have distributed 7,240 devices and 4,225 connectivity packages to learners. The Council have received an additional £5.8 million to further support remote learning, which can be used flexibly to deliver additional devices or connectivity where need still exists.
Joanne Lamont.
Thank you. At a recent meeting of Glasgow City Council's Education Committee, it was revealed that more than 1/3 of primary 1 to 6 pupils in Glasgow identified as needing a digital device for home learning, and they still do not have access to one. Digital exclusion amongst disadvantaged children and young people was already a significant problem before lockdown and remote learning. However, the pandemic has compounded this. I'm sure the Minister will agree that it's entirely unacceptable that 1 year after lockdown, children still do not have access to the devices they need in order to learn. This is not a bonus, but central to their learning. What action can the Government further take to address digital exclusion and ensure young people, including the 35% of Glasgow primary school children identified, do not fall through the net? And how will the Scottish Government focus attention more broadly on this most vulnerable group of young people whose life chances have been very clearly disproportionately affected by the COVID crisis?
John Swinney.
Presiding Officer, I fundamentally agree with the direction of Joanne Lamont's question. I do believe that we are now in an era where the use of a digital device is now central to the effective participation of children and young people in education. And obviously the Government has taken a number of significant steps to enhance the propositions that have already been in place from local authorities. Indeed, Glasgow City Council has a strong record of the provision of devices to young people within its education system. Some other local authorities have opted to provide devices to all pupils, for example, in the Scottish Borders Council. So certainly one of the priorities that the Government has pursued throughout the pandemic to address that digital divide through the work that I've recounted in my earlier answer, and also through the work on Connecting Scotland, which has been taken forward by my Cabinet colleague, the Community Secretary, Aileen Campbell. It remains a significant priority for the Government, and it's one that we will pursue actively should the Government be re-elected in May.
Supplementary from Claire Adamson.
Beg your pardon, sorry, that was for a question.
I would have thought you'd have known by now. Okay, question number 2, please, Sandra White.
Thank you very much, Presiding Officer. To ask the Scottish Government what recent discussions it's had with Glasgow City Council regarding the provision of Gaelic medium education.
John Swinney.
The Scottish Government has regular discussions with Glasgow City Council on matters relating to Gaelic medium education, and we've been delighted to support the expansion of provision within the city. This month, my officials met with Glasgow City Council staff and discussed the Council's management of the P1 and P2 entry, Gaelic probationers, and the support that can be offered to the high proportion of parents who do not speak Gaelic at home.
Sandra White.
I thank the Cabinet Secretary for that very encouraging answer. It is my understanding that GCC have, or Glasgow City Council, sorry, has 140 GME places available. However, to date, 170 applications have been received, which is also extremely encouraging but disappointing. Can the Cabinet Secretary provide assurances and support to ensure that those who seek to place their children within Gaelic medium education in Glasgow will have the opportunity to do so?
John Swinney.
Presiding Officer, there's a lot of encouraging news in the work that Glasgow City Council is undertaking to support Gaelic medium education. The City Council has reached another high this year with around 160 primary ones seeking entry. Now, the Council often finds there is a drop-off in applications before places are taken up, but obviously the expansion of the City Council's Gaelic medium education estate from 3 primary schools to 4, a 4th school is being supported by the Scottish Government, will obviously, I hope, give reassurance to Sandra White and her constituents that there is further expansion of Gaelic medium education planned within the City Council. And I want to pay tribute to the City Council for the energy and commitment that they have given to this important policy objective. Lastly, President Officer, let me say that this will be the first time the last time that I respond to a question from my dear friend Sandra White, and I wish her well on her retirement from Parliament.
Question number 3 is Neil Bibby.
Thank you, Presiding Officer. To ask the Scottish Government what resources it has provided for investment in the West College Scotland campus.
Richard Lockhead.
Since financial year 2014-15, there has been an investment of £20,650,274 in the West College Scotland campus.
Neil Bibby.
I thank the Minister for that answer. West College Scotland has not received its fair share of investment for years, and the college capital budget is being cut. As far back as 2017, the Scottish Funding Council Estate Survey identified the need for significant investment in both Paisley and Greenock campuses and the potential of plans for new fit-for-purpose buildings. The Scottish Government's infrastructure strategy to 2025 does not give any indication at all that there will be funding for estate development in Paisley or Greenock. So can I ask the Minister, when will the Scottish Government invest in a modern campus for West College Scotland students in my region?
Richard Lockhead.
Can I just assure Neil Bibby that the Scottish Funding Council considers securing funding for the replacement of the campuses at West College Scotland is very much a high priority, and indeed more resources were given to the college in recent times to progress their outlined business case for those improvements. I think it's well documented that capital budgets have been under pressure for many years now, and that's recognised, but it's certainly the case that we do believe that the college does have a strong case, and as soon as the resources become available and the outline business case progresses, hopefully further progress can be made.
I have supplementaries from Stuart McMillan and Jamie Green. Stuart McMillan.
For final time, thank you very much, Presiding Officer. I've met with West College Scotland and also been in correspondence with the Scottish Funding Council about the proposed new campus in Greenock. Can the Minister provide an assurance that every effort will be made to assist West College Scotland, provide a facility for future generations, which can also help stem the population decline that Inverclyde has had over the last 30 years and continues to face?
Richard Lockhead.
Well, Stuart McMillan is perfectly correct to highlight the important role that West College Scotland plays in the local economy and the local region. And I do hope that the next Parliament and the next Government continue to treat this college as a priority in terms of the outlined business case for improving the campuses. And as I indicated in my previous answer, that further funding has been made available in recent times to take forward that business case. The SFC is also developing a medium-term estate strategy for the college sector, and I'm sure that West College Scotland will have a prominent place within that.
Jamie Green.
Thank you, Presiding Officer. I should declare an interest as an alumni of what is now West College Scotland in Greenock. The next Parliament will see the 10-year anniversary of what has become college regionalisation. Obviously, it's subject to whoever it does form the next government, but will the Minister and other members ensure that this Parliament scrutinises to make sure that piece of work has indeed resulted in the anticipated reality of what was expected of the regionalisation programme.
Richard Lockhead.
Yeah. Well, Jamie Green, of course, is testament to the excellent college sector in the west of Scotland that we have, and he's illustrated that today with his excellent question. In terms of the role of the college regions, he will be aware that the Scottish Funding Council just now are undertaking a very fundamental major review of the cohesion and sustainability of further higher education in Scotland, and they are indeed focusing on the college regions as part of that wider project. And I think it's absolutely essential this Parliament scrutinises closely the outcome of the SFC review, because it will be so fundamental to the future of Scotland and our further higher education sector.
Question number 4, Claire Adamson.
Thank you very much, Presiding Officer. To ask the Scottish Government what action it has taken to support lifelong learning and reskilling.
Jamie Hepburn.
We are investing significantly in reskilling on interventions in recognition of its important role in supporting future skills transitions, including our just transition to net zero and our economic recovery from the pandemic. This includes through our National Transition Training Fund, which supports individuals to retrain to secure more positive employment outcomes. We have recently confirmed ongoing support for the fund in 2021-22. We've also committed to develop a lifelong learning framework that will raise the importance of adult learning and ensure it's integrated within the wider education and skills system.
Claire Adamson.
Thank you. I'm sure the Minister will join me in welcoming the publication of the Comerford-Little report and the Open University in Scotland's prospectus, Skills in Scotland, both of which call for a skills-led recovery. The OU prospectus sets out a vision to galvanise higher education to support an inclusive economic recovery over the lifetime of the next Parliament. Can I ask what steps the Scottish Government is taking to ensure both higher and further education remain open and accessible to everyone throughout any stage of their life?
Jamie Hepburn.
Well, the Comerford-Little report has a very important one, which we are considering very closely. It aligns very neatly with our wider ambitions through the Future Skills Action Plan and the wider skills realignment we need to see in relation to the Open University. As ever, they are an excellent organisation in terms of their approach to lifelong learning generally. Recently, in that regard, they've become involved in the Flex Workforce Development Fund, which I have responsibility for, which has now been opened up to small and medium enterprises, and they're leading on that element of work. In terms of the wider question, in terms of accessibility to higher education, we will, of course, continue to invest significantly in higher education this coming financial year. And in relation to accessibility, of course, one of the fundamental things that we will continue to do is retain our commitment to free university education. One of the questions at this election that's coming is, will the other parties follow suit?
Question number 5, Jamie Halcrow-Johnson.
To ask the Scottish Government what support it will provide to schools in light of its announcement regarding the full-time return of pupils in April.
John Swinney.
Presiding Officer, to date, we have committed over £375 million to local authorities and schools as part of education recovery. This investment continues to fund additional teachers, support staff and costs of necessary safety mitigations in schools, such as infrastructure adjustments. We are currently updating and will publish before Easter relevant guidance. I've emphasised the importance of supporting young people's wellbeing as they come back to school, and work is already in train across partners to deliver wellbeing and outdoor activities. As with all aspects of our education response to COVID, I have been grateful for the expert advice of the COVID-19 Education Recovery Group as we have formed plans for the full-time return.
Jamie Halcrow-Johnson.
I thank the Cabinet Secretary for that answer. Since the indication of schools returns was made, there has been a less equivocal stance, particularly in relation to secondary pupils coming from the Scottish Government. So can I ask you firstly, can he confirm if he will give minimum notice period for any changes to scheduled returns after the Easter holidays to help parents and carers to plan? And can he further assure local authorities that additional costs faced because of mitigation measures that he has recognised will be essential to enable pupils to return will be adequately supported by central government rather than coming out of local education budgets?
John Swinney.
Presiding Officer, the Government's central planning assumption is that schools will return full-time for face-to-face learning after the Easter holidays, which in some parts of Scotland is on the 12th of April, in the overwhelming majority of areas of Scotland is the 19th of April. Now, of course, we have got all primary schools and early learning centres back full-time, and secondary schools are back for all pupils, but not on a full-time basis, supported by remote learning. Our objective, our central planning assumption, is to return secondary schools full-time, but we obviously must be take into account the prevalence of the virus at that particular stage, and we will give as much notice as we possibly can do on the approach to return. The Education Advisory Group, which provides us with clinical advice on these issues, will meet on the 6th of April, and we will receive their views, and obviously that will influence us in the planning and steps that we take to reopen schools full-time with effect from the 12th of April in some parts of the country. On the issue of money, the government has committed over £375 million to local authorities as part of education recovery. That is a very significant investment by the government in the additional costs of the delivery of education at local level. And we will, of course, continue to discuss any issues that arise from such a substantial financial contribution by the government with local authorities in due course.
Question number 6, Jeremy Balfour.
Thank you, Deputy Presiding Officer. To ask the Scottish Government whether it will provide an update on what it is doing to ensure that pupils are able to catch up on any learning lost as a result of school closures.
John Swinney.
Presiding Officer, I think any focus on the term lost learning is not an appropriate description of the challenges that we face and does a disservice to the work of school staff across the country. Last week's Education Recovery Group reinforced the importance of supporting children through positive action, with a need to focus on well-being and learning as we move towards full-time return of school. Work is already underway to consider what support our young people might require over the summer term and the summer holiday. We are working with local authorities and Education Scotland who share this ambition, and discussions are underway to understand what strategic action is needed at the national level to support and facilitate specific and meaningful local activity in schools.
Jeremy Balfour.
Can I thank the Cabinet Secretary for his answer, but with respect, having looked at my own children, they have lost out. There are things that they have not been able to learn in the last year because of the closure, and that does need to be caught up at some point. The London School of Economics says that we need to invest millions of pounds into doing that, and we as a Conservative Party are going to fund £120 million to spread across 2 years. Can the Cabinet Secretary provide assurances that their catch-up programme will be similarly ambitious in scale and will allocate funding directly to schools who are best placed to target their funding where it is most needed?
John Swinney.
President Officer, I won't reiterate the comments I made about the language and terminology that Mr Balfour insists on using in this question. I don't think it's a particularly helpful description of the challenges that we face. I think young people have learnt a great deal over the course of lockdown. That's a tribute to their families who've supported them, to their carers, and also to their schools for supporting their learning. And I think a great deal has been accomplished through remote learning, which has supported young people adequately. I explained at length to the Education and Skills Committee this morning the importance of supporting individual learning, and the education system will ensure that is the case. In relation to the Conservative Party's plans, well, I suppose the voters will have a choice on that on May the 6th, and we'll see what they make of that. But based on the performance of the Conservative Party at the present moment and their shocking, shabby behaviour over the course of the last few weeks, I don't expect the message will attract much support from the public in Scotland.
Question number 7, James Dornan.
To ask the Scottish Government what support it is providing to assist children from the poorest backgrounds with their education.
John Swinney.
Presiding Officer, our mission to reduce the poverty-related attainment gap remains central to our plans. That is why we have committed a record £200 million to the Scottish Attainment Challenge, including the introduction of a £20 million pupil equity funding premium for 2021-22, which emerged from the budget discussions and agreement with the Liberal Democrats. We also continue to support our young people from low-income backgrounds with free school meals and the National Minimum School Clothing Grant, and of course there was expansion to the free school meals provision agreed in the budget with the Green Party. Our report on progress towards closing the poverty-related attainment gap, published on the 22nd of March, presents a strong body of evidence that shows good progress has been made towards closing the poverty-related attainment gap.
Sorry, James Dornan.
Thank you, Cabinet Secretary, for that answer. Would you confirm to me that the announcement of an additional £25 million to tackle poverty and equality will not only further enhance that £100 COVID hardship payment for children and young people, but receiving free school meals, but will also enable support to be extended to children who receive free lunches within the early learning and childcare settings?
John Swinney.
President, so these provisions will be in place, and it's part of the wider efforts that the government is undertaking in a number of areas through education expenditure, but also through the wider work that we take forward in collaboration with my Cabinet colleague Aileen Campbell on the in the areas of tackling child poverty, to ensure that we take a series of integrated measures to address the impact of child poverty, which of course has a significant bearing on the educational attainment of children and young people within Scotland, and as part of the government's overall strategy to tackling the attainment gap. Presiding Officer, I'm uncertain as to whether or not you will be calling further supplementaries on this question, but at this moment, could I say this is likely to be one of the last questions that you have called me to answer as Deputy Presiding Officer, and I extend my warmest wishes to you and my grateful thanks for your for being a colleague over the last 22 years, and particularly for the long sentence that we spent in the Smith Commission together.
Thank you very much, Cabinet Secretary, but I'm afraid you've got Ian Gray now.
Thank you, Presiding Officer, and my apologies to the Cabinet Secretary for extending his sentence slightly longer, but I promise it won't be for too long. Presiding Officer, for the whole of this Parliament, the Government has had the goodwill and support of the whole Chamber in its top priority to close the poverty-related attainment gap. And this week's Audit Scotland report does show that it is true, as the Cabinet Secretary has said, that the Government has invested hundreds of millions of pounds through the Attainment Scotland Fund and otherwise to that end. Yet the same report says this, and I quote, "Progress on closing the attainment gap has been limited and falls short of the Government's aims." So as he reflects then, why is it, does the Cabinet Secretary think, that the Government has made so little progress on this, which they themselves called their sacred responsibility?
John Swinney.
Officer, it is somewhat apposite that you've extended my handling of questions by bringing in another member of the Smith Commission who regularly bemoans the fact that I react in an uncharitable fashion to his participation in the Smith Commission, but on his last day in Parliament I will desist from such behaviour. Mr Gray raises issues from the Audit Scotland report, which, as I told the Education Committee this morning, I think is a reasonable and fair report. It recounts the fact that progress has been made in closing the poverty-related attainment gap, but it also recognises that these challenges are stubborn. The report also highlights that progress around the country is differential by local authority area. And I think there's a substantial issue that needs to be explored there, which I will discuss with local authority partners, should the government be returned at the election, to ensure that the lessons of good performance and good improvement that have been achieved in some parts of the country can be reflected in other parts of the country. And that will enable the government to intensify the work that we've said would always take us, would always be a longer-term project than one individual parliamentary term. But I think the key conclusion of the Audit Scotland report is that good progress has been made, and the government will build on that if it is re-elected in May.
Question number 8, Jamie Green.
Thank you. To ask the Scottish Government whether it will provide an update on its roadmap for higher education students to return to university.
Richard Lockhead.
Universities will continue to adhere to the limit of 5% of students for in-person learning at any one time until 26th of April. There will be some limited flexibility above this 5% limit for some specialised and postgraduate courses. Arrangements for any increase in the number of students beyond the 5% limit after the 26th of April will be discussed with universities when, of course, Scotland will move into protection levels. I am pleased to announce today a package of further support for further and higher education students to provide reassurance that they can complete their studies where these have been impacted by COVID-19 restrictions. That package includes full-time HE students being eligible to receive a guaranteed one-off COVID payment of up to a maximum of £1,600 for additional study of 16 weeks or less, and HE students who require extension beyond 16 weeks can apply to SAST and continue to receive the standard monthly package of bursary, grant, loan and fees until their extended course date ends.
Jamie Green.
Can I thank the Minister for that update? But there remains concern that for the majority of higher education students, a meaningful full return to campus is not currently proposed until May, and even then it's only for blended learning. Under the Government's current roadmap proposals, students will be able to go to the pub, but not to lecture theatres. So can I ask, if the virus situation allows for it, are there any plans to alter the course of action and allow more students to get back onto campus as quickly as possible?
Richard Lockhead.
We are taking a cautious approach in Scotland, and our objective absolutely is to allow more students to return to campus when it's safe to do so. And we're paying close attention to the course of the pandemic and the advice from clinicians and others. And as I outlined in my initial answer, we're keeping this under very close review. And after the 26th of April, we'll take a decision as Scotland hopefully will move into protection levels as to what that means for further and higher education. So please rest assured we are absolutely determined to ensure that as many students can complete their courses and get a degree of university experience, if it's safe to do so, before the end of this term. And we hope to make that progress.
That concludes portfolio questions in education and skills, and now we'll move on to the health and sport portfolio. And I have question number 1 from Monica Lennon.
Thank you, Presiding Officer. To ask the Scottish Government what financial commitment it has made to support the delivery of the refreshed heart disease improvement plan.
Marie Goujon.
Heart Disease Action Plan on the 23rd of March, so just yesterday, and confirmed an initial investment of £2.2 million to drive forward the actions in the plan. And that represents a doubling of investment from the previous Heart Disease Improvement Plan. Now, delivery of the actions contained within that plan will enable us to minimise preventable heart disease and to ensure that everyone with suspected heart disease in Scotland has timely and equitable access to diagnosis, to treatment and care that supports them in living well with their condition.
Monica Lennon.
I thank the Minister for her response. With 700,000 people in Scotland living with heart disease, the publication of the action plan is welcome. And we know that adequate funding is vital in order to meet the needs of people across Scotland to have the best possible treatment and care. I welcome what the Minister has said about the increase in funding, but in the last iteration of the plan, the funding was only £1 million, and that's compared to £117 million for cancer and £42 million for type 2 diabetes. What is the Minister's response to those campaigners and patients who don't yet feel convinced that heart disease is a strong enough priority for the Government?
Marie Goujon.
I would assure everyone that tackling heart disease is a strong priority for this Government, and I would say that what we've proposed is the initial investment, and as I've just said in my previous response, that represents a doubling of resource to what was provided previously. But I would also say that the delivery of the key actions within the Heart Disease Action Plan, such as the effective use of data that we've outlined in priority 4 of that will all enable us to ensure that the appropriate future allocation of resource is done in a way that will drive forward improved patient outcomes. So I hope that provides some assurance to the member.
Supplementary from Kenneth Gibson.
Thank you, Presiding Officer. In 2019, I raised the fact that while heart disease kills 3 times as many women as breast cancer in Scotland, evidence revealed by the British Heart Foundation showed that the prognosis for female patients remains much poorer than for men. Can the Minister advise what steps have been taken over the last 2 years to involve medical professionals in improving this unacceptable situation?
Marie Goujon.
think in relation to the member's question that we absolutely recognise the significant impact of heart disease on women in Scotland, and that's why in our programme for government we made a commitment to the development and implementation of a women's health plan, and we included cardiac disease as a key pillar of that plan. So the aim of the plan will be to reduce women's health inequalities by raising awareness around women's health and improving access to healthcare for women throughout their life. And implementation of the actions within the Women's Health Plan will align with the implementation of the Heart Disease Action Plan, which highlights the importance of tackling inequities in access to diagnosis, to treatment and care for people with heart disease.
Question number 2, Claire Baker.
Thank you. To ask the Scottish Government whether it will provide an update on what action it is planning to address the backlog in cervical screening appointments that has arisen because of the COVID-19 pandemic, and whether this will include offering HPV self-testing.
Marie Goujon.
The Scottish Government has provided just under £1 million in support to support capacity in sample taking and colposcopy. And the impacts of COVID-19, including the need for additional infection control measures, continue to present challenges, but these are being kept under close review. There aren't any plans at the moment to issue self-testing kits as part of the programme's recovery. And that's because while it continues to gather evidence, the UK National Screening Committee hasn't yet recommended that self-sampling should be incorporated into the national programme as yet. But a pilot study is underway in NHS Dumfries and Galloway, and a more extensive pilot is currently being scoped.
Claire Baker.
Thank you. As the Minister will know, there is a reported backlog of 6 months within the screening programme, and Joe's Cervical Cancer Trust has called for a rollout of the self-testing. Screening rates are lowest among young women and in the most deprived areas. So I would urge the Government to push forward with a wider rollout of self-testing, at least for these groups. And I do recognise the pilot that's taking place in Dumfries and Galloway and welcome that there's scoping for further pilots. But I would hope that, given the circumstances we're living under, and we're still in a lockdown situation, that we could see faster progress in using the self-testing kits to extend the number of women who take part in the programme.
Marie Goujon.
I can completely understand why the member and why other members would ask for faster progress on this, but I do think it is obviously vitally important that we take the best clinical available advice and base our decisions on that. And that's where we do base the advice on the UK National Screening Committee, who haven't yet advised us to do that. But that's where I think the pilot that we have got underway is really important. And as I said in my first answer, we will be scoping out a further research project, because I think that could be a really important piece of work, but I think it's really important that we make sure that research takes place, that we can learn any potential lessons from it, and then take the further clinical advice to see whether that's something we should roll out or where we go next.
Question number 3, Maurice Corrie.
To ask the Scottish Government what action it is taking to ensure wider accessibility to organised sport for children and young persons and people once restrictions on this are lifted.
Marie Goujon.
Physical activity and sport have an absolutely crucial role to play in Scotland's recovery from the COVID-19 pandemic. And in the schools environment, the Active Schools programme will remain a central pillar in getting young people to participate in sport. And it will be vital that we work with and listen to young people to really rebuild that enthusiasm for sport too. Now, the programme for government commits Scottish Government to working with Sport Scotland and the Scottish governing bodies of sport to rebuild membership and participation levels following the negative impacts of COVID-19, as well as to build on the positive sport and physical activity behaviour changes that we've also seen during the pandemic, such as increased walking and cycling, and build wider community participation, particularly within disadvantaged and underrepresented communities.
Maurice Corrie.
I thank the Minister for her answer. There is understandable concern that COVID-19 has exacerbated inequality of access to sport for children from disadvantaged communities, at the same time worsening the impact on mental health and well-being. Can the Minister offer details on how the Scottish Government is actively assisting local authorities, ensuring that every child is able to participate in organised sports, such as swimming lessons, especially given the role sport can play in bridging the inequality gap for those living in poverty?
Marie Goujon.
The member is absolutely right, and that's why we see this as a key focus as we transition out of the pandemic, because physical activity is so hugely important in improving people's physical and mental health. And that's where I talked about the work that we're doing with Active Schools and that network. That's going to be really important as we move forward. And there's also, we've had sports facilities funding, which has been announced today by Sports Scotland, which is £900,000 worth of investment for clubs, for communities, for leisure trusts, and really to do exactly what the member's asking for that more diverse, to provide more diverse and inclusive opportunities for people, and about improving access to sport and physical activity for communities. And the First Minister outlined today a summer programme of activities as well, of which I hope that sport and physical activity will play a key role too. So I hope with all these activities, broadening access, we're able to address some of the issues that the member raises.
Question number 4, Annie Wells.
To ask the Scottish Government what its response is to research by Edinburgh University suggesting that more than half of severe COVID-19 cases were as a result of transmission in hospital during the second wave of the pandemic.
Jane Freeman.
The research study makes an important contribution to our consideration of all of these matters. However, it is limited in that it uses a wider nosocomial definition than has been agreed internationally, and that extended time frame overestimates nosocomial COVID-19 from the indeterminate category. That does make it reduce the opportunity we have to identify areas for improvement. However, this is an important piece of work, and it adds to the overall knowledge that we have about nosocomial infection and the additional steps that we need to take on top of those already taken in order to try and reduce this as far as possible.
Annie Wells.
I thank the Cabinet Secretary for that answer. But as we remobilise the NHS from the grips of this pandemic, can the Cabinet Secretary just explain how the Government will prevent this from happening again?
Jane Freeman.
So in answering this, I need to just add a touch of realism here in terms of happening again. As one of the report authors notes, it is, and I'm quoting, "The reality is there are a number of constraints on the ability to have complete infection protection in hospital settings. The reasons for that are multifactorial and complex, one being the built environment, where some of our older hospitals do not have single rooms, for example. And it is, we need to be careful in comparing wave 1 and wave 2, given that in wave 2 we were dealing with a virus that is significantly more infectious than the virus strain that we were dealing with in wave 1. All of that said, though, there are a number of additional steps in place on top of the world-renowned Scottish Patient Safety Programme. So there is additional PPE, of course. There is now testing of all admissions to a hospital setting, from emergency right through to planned and including maternity. There's testing of our patient-facing and now extended to other NHS as well as social care staff. And there is, of course, the constant monitoring that our clinical advisors do, led by our Chief Nursing Officer and the nosocomial group that brings in additional academic and clinical experts to identify whether, looking internationally and elsewhere in the UK, whether there is more that we can do in addition to the steps I've already outlined.
Supplementary from Jackie Bailey.
Hospital transmission of COVID-19 remains an issue, with data for the week of the 28th of February showing at least a further 30 cases. Staff have been raising their concerns for several months now, and the Scottish Government does need to safeguard staff. Can I ask the Cabinet Secretary what has been done to ensure that enhanced PPE is provided? And, Presiding Officer, could I take this opportunity to wish the Cabinet Secretary well in her retirement and thank her for her cooperation over the years?
Jane Freeman.
Thanks very much, and my thanks to Ms Bailey for those kind words. She is right. Nosocomial infection of any virus in a hospital setting, and indeed in other institutional settings, is really important. We have listened carefully to what staff have said to us about PPE. Our clinical advisors continue to look at this and see if there is more that can be done in terms of the PPE that staff are clinically advised to use. But of course, what we have also stressed most recently in communication with staff is the importance of individual staff members undertaking their own assessment of the risk that they believe that they face and exercising their professional judgment. Guidance is really important. Provision of PPE is really important, and I need to here record my thanks to our National Services procurement exercise that ensured that we never ran out of PPE at any point in this pandemic. But what is additionally important is that you leave room around that guidance for the professionals to be able to make their own judgment and management to then enable that clinical judgment. And where there are instances where there are difficulties around that, I'm very happy to intervene and ensure that the professional judgment takes first place.
Question number 5, Emma Harper.
To ask the Scottish Government whether it will provide an update on the short review into cancer pathway arrangements and reimbursement of travel expenses for patients in Dumfries and Galloway when it committed to carrying out a review on 24th of November 2020.
Jean Freeman.
I'm grateful to Ms Harper for her question. As I've previously explained, the pressures of the pandemic means that NHS Dumfries and Galloway and the board's partners have paused reviewing cancer pathways, which is a complex piece of work, and will return to that issue in the spring. So shortly, as we see case numbers come down, then the pressure on Dumfries and Galloway lessens. I've set out previously in the Chamber that the patient travel guidance will be comprehensively reviewed and will take full account of matters raised by Ms Harper. The review is a substantial exercise for Government and NHS boards, which requires prioritisation alongside our response not only to the pandemic but to the remobilisation of NHS services. And further updates will be provided as that review progresses.
Emma Harper.
I thank the Cabinet Secretary for that response, and I thank her for everything she has done in this Parliament and wish her all the very best for the future. My constituent, Dr Gordon Baird, on behalf of Galloway Community Hospital Action Group, has lodged a petition which urges the Scottish Government to explore the creation of an agency or a commissioner to address the health needs of people in rural Scotland. Australia have already done this, and I'm due to meet Australia's Rural Health Minister to hear whether something like this could be established or addressed to help support people across Stranraer and Wigtonshire. Can I ask the Cabinet Secretary whether, in principle, the Scottish Government would be open to looking at the creation of a Rural Health Commissioner?
Jean Freeman.
I'm grateful to Ms Harper for that question. I'm very happy to go beyond principle and let her know she will be very familiar, I know, with Sir Lewis Ritchie, who has undertaken considerable and very valuable work for us in looking at remote and rural medicine, instituting a number of improvements and, importantly, listening to practitioners in those areas. I'm very happy to let her and the Chamber know that work is underway to establish a National Institute for Remote and Rural Medicine and Healthcare Practice. And should this government be returned following the election, we will take every step to ensure that it is put in place as soon as possible.
Supplementary from Elaine Smith.
Thank you, Presiding Officer. On the issue of reimbursement of patients' travel expenses, will the Scottish Government consider providing a review on reimbursement for chronic pain patients who have been forced to travel to England for pain relief and to pay privately because Scottish NHS pain clinics were closed during earlier lockdowns, and of course some patients are still having to go to England as waiting times have doubled? And can I also wish the Cabinet Secretary all the best for the future?
Jean Freeman.
Thanks very much, and can I thank Ms Smith for her question. She has been a doughty champion of this and many other issues during her time in this Parliament, and extend my best wishes back to her. She raises a really important point. As she will know, the current Act and the legal advice on that Act prevents us from using public funds to reimburse where that out-of-area Treatment has not been followed through on the basis of an NHS Scotland referral. However, as she will know, I hope, today we announced our intention, should this government be returned, to bring forward legislation to ensure that mesh-injured women who have sought private treatment out of area can be reimbursed, and I would hope that my successor will consider what other areas may be appropriate in that regard.
Question number 6, James Kelly.
Thank you, Deputy Presiding Officer. To ask the Scottish Government what action has been taken to reduce hospital waiting times.
Jane Freeman.
We're currently working with all health boards across Scotland with specific targeted action to reduce hospital waiting times. That includes the investment of additional resources, £60 million to be used directly to support specifically elective care, progressed within the context of the clinical prioritisation framework that I published in November. Additional investment to increase diagnostic capacity with 3 new scanners, CT scanners, ensuring access across all regions. Our first ever in Scotland early cancer diagnostic centres, 3 to be due to come on stream by the summer of this year. And of course, as Mr Kelly knows, the continued expansion through our elective centres with NHS Golden Jubilees Phase 1 expansion supporting eye care and orthopaedics now open and treating patients. The additional point, though, that I would make is that we need to recognise, as we remobilise our NHS, we need to take account of the fact that our NHS staff, very many of them, have worked tirelessly for over 15 months. They are still working in those pressured conditions. That has taken a physical and an emotional toll on them. And as we plan the recovery of our health service, we need to understand that they are our greatest single resource, and we need to allow time for them to recover so that they can continue to do the really important work that we need them to do and that we ask them to do.
James Kelly.
I thank the Cabinet Secretary for her answer and wish her well. And I draw the Cabinet Secretary's attention to an article by Chloe Smith in this morning's Times. Ms Smith is a consultant orthopaedic surgeon and highlights the unprecedented levels of long waiting times for surgical operations. Even a 20% increase would mean that it would take 4 years to clear the backlog. This is a really serious situation. So can I ask the Cabinet Secretary what action has been taken to reduce these waiting times so that people waiting on knee replacements don't have to wait 4 years to get some relief from their pain?
Jane Freeman.
So Mr Kelly is quite right. This is a really serious issue, and it has inevitably been created or exacerbated considerably by the past 15 months when the NHS pivoted largely, certainly in the first wave, paused all but urgent and emergency treatment and some cancer treatment in order to deal with COVID. In the second wave period, we have begun to remobilise. We did some useful work, our NHS staff did useful work over the summer period to begin to catch up, but then the second wave hit and that was inevitably reduced. There is very specific work underway to look particularly at elective wait times as well as additional work on cancer, as Ms Goujon highlighted earlier. When this session of portfolio questions finish, I am going straight into a meeting with the current Chief Operating Officer of the NHS, John Conahan, to look in detail at additional actions to those that I've set out, and I would hope that we would be able, should this government return after the election, which I very much hope it does, be able to set out a comprehensive remobilisation plan. Officials are well underway in that work. All our boards have produced their own immediate plans. We're bringing those together to look at how we progress in order that people do not wait as long as Mr Kelly suggests that they do, because that would not be acceptable, whilst at the same time we make sure that our NHS staff, who have worked so very hard indeed and for whom we owe significant thanks, are given time to take the annual leave that they've postponed, to have the rest and the recuperation that they need in order to carry forward the work that we want to undertake. Presiding Officer, I don't know if you would allow me a moment Parliament's flexibility to say a few things, since I think, unless there's another supplementary, this will be the last that I will say in this chamber. I just want to make a couple of points, and there's a number of people I would like to thank. I have been very privileged to be here. I've been especially privileged to hold 2 ministerial offices. And if my voice is now shaking, it's because you're all unusually being very nice to me, and I am very grateful to you for that. I've learned a great deal, certainly in social security, in establishing that service, but undoubtedly in the health service. And I have been honoured to be the Health Secretary, to play my part in working with our health service. The people I particularly want to thank, of course, are my constituents in Carrick, Cumnock and Doon Valley, undoubtedly the most beautiful and talented constituency in the whole of Scotland, and I hope that Elena Whitman will follow me to represent that constituency. But my thanks to them for electing me in the first place, to my constituency team, without whom none of this would be possible, to our civil servants and advisers, sometimes perhaps unintentionally, but certainly indirectly maligned. They do a fantastic job, and our clinical advisor team, I think, are second to none. And then finally, to a group of people who are rarely mentioned, but without whom Cabinet Secretaries and Ministers would flounder, and that is our private offices. I have been fortunate in 2 quite remarkable private offices to whom I owe a great deal of thanks. And lastly, Presiding Officer, my very best wishes to you in your retirement after many, many years of outstanding service to this Parliament and to the people of Scotland. Thank you.
Oh, well, I'm going to indulge myself now. Question number 7, Tom Arthur.
To ask the Scottish Government how it is supporting mental health services in the Renfrewshire South constituency.
Claire Hawkey, who's having trouble with her camera, so we'll just hear from Claire, I hope. Perhaps. Perhaps that might not have been your last word, Cabinet Secretary. We'll just give it a moment. Oh, we've lost Claire Hawkey. It's a very specific question. Cabinet Secretary, would you be able to perhaps address a little bit for Mr Arthur if he asks his question again? Tom Arthur.
To ask the Cabinet Secretary what support the Scottish Government is providing for mental health services in the Renfrewshire South constituency.
It's a very specific question, and I will make sure that Mr Arthur gets the detail of the answer that Ms Hawkey would undoubtedly have been able to give. I can say a couple of things I think are really important. First of all, the Mental Health Transition Plan that Ms Hawkey has overseen provides significant additional resource to mental health recovery, focusing not only on CAMHS waiting times, but on preventative and well-being mental health for the wider population. And secondly, that I am pleased to say that a significant number of the community wellbeing centres that we announced in a previous programme for government are already ready to be operational from the 1st of April, and others will come on stream very shortly after. Those provide wider support services, particularly for children and young people and their families, focusing certainly on mental health, but having a very preventative and supportive focus, all of which I think will be of considerable benefit. And as I said, I'm very happy to ensure that Ms Hawkey provides detailed answer to Mr Arthur before today is out.
Mr Arthur has waived his right to supplementary. Thank you very much, Mr Arthur. And I call question number 8, Bill Kidd.
Thank you very much, Presiding Officer. To ask the Scottish Government what action it is taking to encourage women and girls to participate in organised sport.
Mary Gouchon.
The Scottish Government appreciates the importance of sport and physical activity for women and girls in Scotland and the positive impact that it has on their physical and mental health. And as we look to rebuild sport in Scotland, we'll have to all support women and girls to safely return to sport. Now, the Scottish Government is committed to working with Sport Scotland and the Scottish governing bodies of sport to rebuild membership and participation levels following the negative impacts of the pandemic, and to enable women and girls to undertake supported group exercise outdoors. We recently announced that from the 12th of March, group organised outdoor non-contact sport and physical activity could resume, and similarly, organised outdoor contact sport for boys and girls under 12 can resume from the same date, subject to sport-specific guidance.
Bill Kidd.
I thank the Minister for her answer and welcome the action that the Scottish Government is taking to break down the barriers that many women and girls face in accessing organised sport, and believe it's important that women and girls are well represented in the sporting community of Scotland. Can I also ask the Minister what action the Scottish Government is taking at a local level, particularly in schools, to encourage young girls to participate in sports at a younger age, as we know that teenage girls in particular are increasingly likely to drop off from participating in organised sport?
Mary Gouchon.
Particularly in the schools environment, the Active Schools programme will remain a central pillar in getting young people participating in sport, and we have over 400 active school staff across the 32 local authorities. Prior to the pandemic, in a single year, over 300,000 young people made a combined 7.3 million visits to active school sport and physical activity sessions before school, at lunchtime and after school, and that was supported by 21,000 volunteers. And to get back to and surpass these levels, it's going to be vital that we work with and listen to young people to rebuild that enthusiasm for sport. And through the Young Ambassador programme, there are 150 registered secondary schools. So Sport Scotland will target these schools to support those young ambassadors to promote participation in sport in their schools too. But I also think it's really important that we raise the profile of women in sport. I think we have some fantastic role models, and I think it's really important to highlight that. We also seem to do particularly well when it comes to sports like football and netball too. So I think we all have a role in talking about these really important sports and where women really do excel, and making the most of these really positive role models that we have.
That concludes portfolio questions in health and sport. We'll now move on to communities and local government. Questions 6 and 8 have been grouped together, but that is now the only grouping in this portfolio. So those who wish to ask a supplementary, please press the request to speak button or put an R in the chat function during that question. Question number 1, Christine Graham.
Thank you, Presiding Officer. To ask the Scottish Government what progress has been made on increasing levels of community engagement since the enactment of the Community Empowerment Scotland Act 2015.
Aileen Campbell.
Thank you. Since introducing the Community Empowerment Act in 2015, we have taken many positive steps to increase community engagement. We introduced participation requests and asset transfers, which provide a powerful mechanism for communities to participate in public decision-making and take control of public land and buildings. Investing in Communities Fund, launched in 2019-20, backed with around £11.5 million each year over 3 years, enables communities to decide on their own terms how to address local challenges. Our National Support Programme for Participatory Budgeting has enabled over 122,000 voters to have a direct say on the allocation of millions of pounds. And we're working in partnership with COSLA through the Local Governance Review to help further empower communities and strengthen local democracy.
Christine Graham.
I thank the Cabinet Secretary for her response, and as this is her final appearance in the Chamber, I wish her well. The COVID pandemic has brought communities together as never before. Broughton Community Shop, Tweed Togs, the Bridge Galashiels, Tweed Dale Youth Action, Pennycook Ambassadors, Gorebridge Resilience and many more, but I don't want to try your patience, Presiding Officer. Does the Cabinet Secretary agree that this really is community empowerment and something upon which the legislation allows communities to build?
Aileen Campbell.
I absolutely would agree with all that Christine Graham has said. Thank her for her kind words as well. I am very familiar with some of the groups that she's
outlined, particularly the Broughton shop, which is just over the hill from me in Biggar, and they've done a phenomenal amount of work. If it hadn't been for our communities, the country simply wouldn't have been able to demonstrate the resilience that it has over the last year. We need to take that learning, make sure we don't lose that, because if we trust our communities and support our communities, then Scotland will succeed and will meet all of our aspirations on our national performance framework. So I pay tribute to all of the work that Christine Graham's constituents have done over this last year and say a sincere thanks to them, because without them we wouldn't be where we are. Thank you.
Question number 2, Lewis MacDonald.
To ask the Scottish Government what support it will provide for the regeneration of the city centre and beachfront in Aberdeen.
Aileen Campbell.
The Scottish Government is committed to working with Aberdeen City Council and other partners as they take forward the City and Beachfront Master Plan. The Government has demonstrated its commitment to Aberdeen and its city region through a variety of strategic investments. This includes a £125 million commitment to the Aberdeen City Region deal, the £62 million committed to the Energy Transition Fund, and significant ongoing capital funding for community-led regeneration. The Government's new £325 million place-based investment programme will also provide further funding to Aberdeen over the next 5 years. The programme will help to link and align place-based investments, ensuring a coherent approach to regeneration with involvement and support of communities.
Lewis MacDonald.
I thank the Cabinet Secretary for that answer, and I too wish her well after her term as a member of this Parliament and a Minister. The Cabinet Secretary will have heard at First Minister's questions about the devastating news for Aberdeen City Centre and regeneration of the proposal to close the John Lewis store on George Street with the loss of 265 jobs. She may also have heard since then that a petition has been launched calling for John Lewis to reconsider that decision, and Aberdeen Economic Partnership has offered to engage with the John Lewis Partnership to discuss ways in which that decision can be reconsidered. Would the Scottish Government support that offer from the Aberdeen Economic Partnership, and will she work with all concerned to seek to persuade John Lewis to reverse this decision?
Aileen Campbell.
Thank you, and thank the member for his question. Like the First Minister, we share the disappointment to hear of John Lewis's plans, and appreciate that this will be an incredibly concerning time for the staff involved and their families. The First Minister also intimated that there would be support there through the PACE initiative. However, if the further developments continue, then I think it would be wise for Government to continue to work and to explore all options, to see what can be done and what actions and activity and support might be helpful in this space. I would also point out that we have, in this more general sense, have recognised that our high streets will be critical for our recovery. And today we, along with COSLA, have published our response to the Town Centre Action Plan review, which I would commend to the member. It was led by Professor Lee Sparks, again someone who is esteemed within this field, and I pay tribute to Lee for his work in this area. So absolutely we'll work through and make sure that we work across government, work through any options and opportunities that there may be there, and commit to engage with the member as best we can. I would just also put in record my thanks to him for all his contribution and being for a strong voice for Aberdeen in the North East for many years, and wish him well in the next chapter of his life. Thank you.
Question number 3, Liam MacArthur.
To ask the Scottish Government when it last met Orkney Islands Council and what was discussed.
Aileen Campbell.
Last met with James Stockin, leader, and John Mundell, interim chief executive of Orkney Islands Council, on Tuesday the 23rd of March to discuss a range of issues relating to the relaxation of COVID restrictions specific to Orkney and the islands.
Liam MacArthur.
Can I thank the Cabinet Secretary for that response, and join with others in wishing her all the best. I think I did that already in the debate yesterday. The Cabinet Secretary will be aware of the disparity in funding per head of population between Scotland's 3 island authorities. At present, this represents a shortfall in Orkney's allocation of around £8 million compared to Shetland, and £15 million in comparison to the Western Isles. This has been a long-standing concern of Orkney Islands Council, but little progress has been made over recent years. So does the Cabinet Secretary agree that this disparity needs to be addressed in the next session of the Scottish Parliament?
Aileen Campbell.
I thank Liam MacArthur for his question and for his kind words again. way in which funding goes to local authorities, as he knows, will be through the distribution formula, which is agreed with COSLA. Any changes to that would need to come via COSLA, and of course, whoever is in this place that I have at the moment in the next session can continue to engage with COSLA on that basis. I also would just point, though, that there has been the recent investment through the Islands deal, which my colleague Michael Matheson has taken forward. So there continues to be a real recognition of the importance of our island communities in the success of Scotland. So we'll take on his viewpoint. I'll make sure that my predecessor, or whoever comes into this place next, understands his concern, but it would be for engagement with COSLA to take forward any changes to the distribution formula.
Question number 4, Annabel Ewing.
Thank you, Presiding Officer. To ask the Scottish Government whether it will provide an update on its housing strategy.
Aileen Campbell.
Okay, thank you. On the 15th of March, we published Scotland's first long-term housing strategy, Housing to 2040, a 20-year plan to deliver good quality, energy-efficient, zero-emissions homes with access to good outdoor space, transport links, digital connectivity and community services. It includes new commitments to deliver 100,000 affordable homes by 2032, set a single set of standards for our homes, tackle high rents in the private sector and decarbonise heating in line with our climate ambitions. And as we've said many times before, however, housing is about so much more than bricks and mortar. And this strategy will also contribute to our aims of tackling poverty and inequality and driving inclusive economic growth. To realise the ambition in this strategy, it will require a lot of hard work, but in the pursuit of a fairer, greener Scotland, that work will be more than worth it.
Annabel Ewing.
I thank the Cabinet Secretary for that answer, and I very much welcome the SNP Scottish Government's ambitious house building plans for the next decade. As the MSP for Cowdenbeath constituency, can the Cabinet Secretary provide any clarity at this stage as to what is planned in particular for the Kingdom of Fife in terms of the number of houses to be built, the jobs to be created and the investment to be made?
Aileen Campbell.
Thank you. Scotland has led the way in the delivery of affordable housing across the UK, with almost 100,000 affordable homes delivered since 2007, driven by my colleague Kevin Stewart, who has been a great colleague to work alongside, and I pay tribute to him for his commitment on this. Housing to 2040 includes an ambition to deliver a further 100,000 affordable homes up to 2032, with at least 70% of them for social rent, once the current 50,000 affordable homes target has been delivered. And this ambition will play a role in helping Scotland's economy to recover from the pandemic, including supporting a total investment package of around £16 billion and 12,000 to 14,000 jobs each year. But it's not just about the good homes, it's also about creating great places, and I know how committed Annabel Ewing is to making sure that her constituents are supported and her colleagues in Fife Council. Therefore, we have made over £150 million available for affordable housing in Fife over this Parliament, and this will deliver a range of housing in a mix of affordable tenures, but primarily focusing on social rented housing, which is a key government priority. But I do commend Fife Council for many of their ambitious projects across the Kingdom of Fife to ensure that people across Fife get access to good housing, and will continue to keep her updated about what that means specifically for Cowdenbeath.
Question number 5, Maureen Watt.
Thank you, Presiding Officer. To ask the Scottish Government how it plans to take forward the recommendations by the Tenement Maintenance Working Group in its strategy Housing to 2040.
Kevin Stewart.
Thank you, Presiding Officer. Our new long-term housing strategy, Housing to 2040, sets out our intention to introduce a new housing standard so that everyone can expect the same high standards of housing and accessibility, no matter what kind of home or tenure they live in. The new standard will support our commitment to address common standards in tenements and take action on the recommendations of the Parliamentary Working Group on Tenement Maintenance. And I'd like to take this opportunity in the last day of term to thank the members of that group, and in particular my colleague Ben McPherson, who helped found it.
Maureen Watt.
I thank the Minister for that answer. If in post after the election, will the Minister be bold in following the recommendations such as compulsory owners associations and building reserve funds, so that our wonderful tenement buildings, such as all the granite ones in Torry and in
in my constituency and across Aberdeen will be restored to their former glory.
Kevin Stewart.
We intend to undertake research this year that will consider the need for building reserve funds for tenement dwellings and mandatory owners associations for tenements as recommended by the Parliamentary Working Group. And the outcome of the research will allow us to make a determination on what the levels of building reserve funds should be set at and the cost for mandatory owners associations. So we will take action for the benefit of Maureen Watt's constituents in Tory and in other places. Can I pay tribute to my friend and colleague Maureen Watt, who has been amazing for her constituents in this Parliament. Maureen and I go back a long way, 30 years. She's been the best possible friend, and the only time that she's ever really feared me is when I thought she was going to go into labour in a car that her and I were in a snowy country road.
Too much information, Mr. Stewart. Right, we'll move on quickly. Question number 6, Ruth Maguire.
To ask the Scottish Government what action it will take to increase the number of affordable homes.
And how well do you know Miss Maguire, Mr. Stewart?
Not that well, Presiding Officer. As the Cabinet Secretary has mentioned, having already delivered almost 100,000 affordable homes since 2007, we want to deliver another 100,000 homes by 2032, with 70% of those being for social rent. As our 20-year housing strategy, Housing to 2040, sets out, this ambitious target will begin when the current 50,000 affordable homes target has been delivered, and work to continue to do all of that safely is ongoing. To start on this path, we're investing an initial £3.44 billion. Delivering these homes, of course, will be beneficial to Scotland's communities, and it will also provide a significant economic boost, supporting a total investment package of around £16 billion and up to 14,000 jobs a year.
Ruth Maguire.
Officer, I thank the Minister for that answer. Within the strategy, can I particularly welcome that the new housing standard applies to all tenures so that everyone is living in good quality accommodation, regardless of whether they own it or rent it from a private or social landlord. I've had a number of constituency cases where the local authority have delayed the repairs to damp properties, including to the homes of folk vulnerable due to their age or medical conditions, citing the pandemic restrictions as the reason. After making representations to them, these have been resolved. However, I wonder if the Minister could confirm that such repairs are deemed essential and that all landlords have a responsibility to maintain their stock and nobody should be expected to stay in a damp property.
Kevin Stewart.
Presiding Officer, I appreciate that dampness in folks' homes can be extremely distressing. Any house let by a social landlord must be substantially free from rising and penetrating damp. And if problems come to light, any repairs must be carried out as soon as is reasonably possible. Repairs of this nature can be carried out under the coronavirus restrictions, where the work is essential, can be done safely, and where owners or tenants' permission is granted. The current regulations set out the essential works for minimum standards of habitability, safety and maintenance, for example, to prevent significant problems developing they should be carried out in people's homes at this time. And of course, it's up to landlords in consultation with tenants to carry out a risk assessment to ensure that that work can be carried out safely.
Question number 8, Gillian Martin.
Thank you, Presiding Officer. To ask the Scottish Government how many affordable homes it has delivered since 2007.
Kevin Stewart.
Presiding Officer, Scotland has led the way in the delivery of affordable housing, with almost 100,000 affordable homes delivered since 2007. including over 68,000 for social rent, over 15,000 of which were council homes. We want everyone in Scotland to live in a warm home that is affordable and meets their needs, and that is why housing and affordable housing in particular has been and remains a priority for this government. As a member knows, we're on track to deliver 50,000. We were on track to deliver 50,000 homes within this Parliament, and we remain committed to completing that. Unfortunately, coronavirus got in the way of the job. We're working with partners across the housing sector to deliver the remaining homes as quickly and as safely as possible.
Gillian Martin.
Thank the Minister for that answer. Housing provision in rural areas is critical in ensuring we stem rural depopulation and support communities to thrive, as the Minister knows. Can the Minister explain how the Scottish Government's housing strategy will specifically support rural communities like mine in Aberdeenshire East?
Kevin Stewart.
Presiding Officer, we make clear in Housing to 2040 our commitment to take action so that rural and island communities have access to high quality, affordable and market housing, which has been planned alongside the economic and physical infrastructure that's required to help people live, work and thrive in these areas, as well as work to help stem rural depopulation. We have committed to continuing the £30 million rural and islands housing funds, which support additional affordable rural and island homes as part of the wider affordable housing programme. And in addition to that, we have announced new permitted development rights to allow for the conversion of agricultural buildings for residential and commercial uses. Presiding Officer, this might be the last opportunity for me to speak. Can I wish you a very happy retirement, and can I wish all of the best to the Cabinet Secretary and her future endeavours, two cracking South Lanarkshire Quines who are missed greatly.
Thank you very, very much, Mr Stewart. Now call question number 7, Alistair Allen.
To ask the Scottish Government how much it has spent supporting communities affected by COVID-19 in the last year.
Aileen Campbell.
We have allocated more than £1 billion to support local communities through the coronavirus pandemic. This includes over £550 million through the Communities Funding Package, including more than £140 million to tackle food insecurity, £51 million to tackle and to continue the provision of free school meals during the school closures and holiday periods, and over £100 million for the third sector and community organisations. Our 2021-22 Scottish budget includes an additional £100 million to support households through pandemic support payments, meaning low-income families could receive up to £530 additional financial support between last December and the end of the year.
Alistair Allen.
I thank the Minister for that response. The Scottish Government dashboard indeed shows that 6.9 million of the funding that she's mentioned in those areas has been spent in my own local authority area. Can I ask, however, what the Government will do to ensure that funding in this area develops in line with hopefully the positive developments we see as we come out of the final phases of the COVID pandemic in the months ahead?
Aileen Campbell.
I thank the member for his question. We'll always seek to ensure that we can learn all we can from the support that we've put in place to make sure that we can continue to support people during this pandemic, and that our focus will be relentless on ensuring that that is the case, and that's what drives our recovery approach. COVID has exposed the inequalities of our society, and therefore recovery should not be about returning back to normal when normality has failed too many. Instead, we should renew and reform our country to create a fairer, equal Scotland. And guided by the work of the Social Renewal Advisory Board and their calls to action, my colleague Shirley-Anne Somerville and I have published our initial responses to that work, along with £25 million to take forward some of the recommended actions. So ensuring people in place are at the heart of recovery will be the job of the next government and the next Parliament. I expect and I know that Alistair Allen will ensure that that continues to be the case. Presiding Officer, If I may as well, if that's my last opportunity to speak in the Chamber, I'd just like to say a few wee words which will be my final contribution to this Parliament, though I'm aware that I have had many final contributions of late, with Christine Graham last night saying I had more comebacks than Frank Sinatra. But these are my final words, and it's with an enormous lump in my throat that I say all this, as the reality of not seeking re-election to serve the constituents of Clydesdale starts to hit home. Clydesdale, of course, being the most beautiful constituency in Scotland. When I intimated that I would not seek re-election, I said that a big part of that was about wanting to spend a bit more time with my boys, Angus and Crawford, who are grown up fast. They've never known their mum not to be a minister, and when I had my youngest son, I became the first Scottish minister to take maternity leave. But stepping back from frontline politics does not mean stepping back from my aspirations for this country and for our communities. And just as the country relied upon its communities to help respond to the pandemic and help with our resilience, so too will our recovery be dependent upon them, their creativity, their commitment and their ingenuity. Flourishing, vibrant communities that are empowered and trusted will be central to how we reform and renew our country with fairness and equality at its heart. And it has been my privilege to serve as Communities and Local Government Minister and to get a glimpse into the glorious diversity of our communities and all the rich vibrancy they bring. And it's also been a privilege to serve in all of the portfolios that I've held. But without this descending into an Oscar-style tribute, I do just want to say a few thanks to my ministerial colleagues and the amazing group of SNP MSPs I've worked and campaigned alongside, all the staff in this Parliament, the posties, the canteen staff, the clerks and everyone who keeps this place ticking over. My office staff in Carluke, Charlie, Ewan and Jack, and my long-suffering private office and all the government officials and SPADs that provide so much support to ministers and have done so much during this challenging year. For now, I'm looking forward to new challenges ahead, including hitting the road with my colleagues to campaign for the restoration of powers to this Parliament. Now, I know we don't all share that objective, but can I say to all the MSPs across this chamber and across the parliamentary divide who I've worked with, chewed the fat with, had some laughs along the way, and to everyone, thank you for being great colleagues. All the best to you, Presiding Officer, as well. Look forward to catching up with you in South Lanarkshire sometime soon. But for me, that's all, folks. Thank you.
Thank you, Cabinet Secretary. And that was a lovely way to conclude portfolio questions, I have to say. And we'll now move on to the next item of business.